My name is Yassah Reed, and today I'll be presenting on who does the algorithm save, preserving humanity with AI in healthcare. So, to start off, I do want to talk about some of our objectives. We'll be going through 2 case studies with AI in healthcare, the impact of AI in healthcare, and considerations for implementation, why should you care, and what can you do. To start off, I want everyone to close their eyes and imagine that they wake up in the middle of the night, curled in pain. You finally make your way to the ER, and when the nurse approaches you, instead of her helping you, she says, "We see your score, and we know that you're drug seeking." While this is jarring, this is exactly what happened in Need Art. And the score, you might be asking, it's the NARC score. The NARC score is made by NARC's Care. It's a machine learning platform that basically uses data points from the prescription drug monitoring program to help clinicians assess whether or not a patient is at risk for overuse, abuse, or misuse of opioid drugs. And where the data comes from, the prescription drug monitoring program, it was originally created for law enforcement use, and the data points that it collects are things like the number of prescribers, the number of prescriptions, data points that are actually used to figure out if a patient is actually doctor shopping, which makes up less than 1% of opioid patients. Understanding that, let's understand a little bit about the populations that are most affected by this bias. The algorithm is the most biased towards women, individuals with chronic illness, and individuals who go to teaching hospitals. And you might ask, where does this bias come from? The issue is that we don't really know, because what's actually going on is held behind the algorithm that is property of Bamboo Health. But that aside, let's also look at the false positive and the false negative rate. So false positive means that people who are being flagged for misuse and abuse who are not at risk. And the false negative, so people who are not being flagged, who are actually at risk. That means that miscategorizes 1/3 of patients. If you look to your left and you look to your right, that means at least one of you guys will be miscategorized. And while Bamboo Health says this algorithm should not be used solely to make any kind of medical decisions for clinicians, let's see what an actual ER doctor said. "I've got red warnings coming at me, which make me feel like the medical board may be after me if I do something to control his pain." So, you guys see, there is definitely some issues with the way that this AI was implemented with healthcare. But let's take a look at TRUES. TRUES is a different machine learning algorithm, and TRUES stands for Targeted Real-Time Early Warning System. And basically, it helps clinicians with early detection of sepsis. It uses EHR data, and it also uses physiological markers. Oh, sorry about something weird is going on with that. But when it comes to TRUES, to really understand the impact, you have to understand sepsis. Sepsis is a condition where, in response to an infection, your body starts to attack itself. It claims over 250,000 American lives, with the only difference between life and death being early intervention. So, understanding TRUES, let's look at the impact. So, sepsis is the cause or the leading cause of mortality rates in hospitals, with a 12 to 30% mortality rate. That 30% affecting more elderly folks. In the hospitals where TRUES was implemented, it reduced mortality by 18%. And it detected 80% of sepsis cases before clinical onset. So that means before the patient had physical symptoms. Not only that, but it allowed providers to respond up to 3 hours earlier. So we went through an implementation of an AI system that was not done with too much care, and an AI system that has overwhelming positive outcomes for patients' lives. But I want to take a step back, because what we can learn from these implementations go far beyond healthcare. Whether you're implementing an AI system in healthcare or anything, you should be asking yourself these questions. Is this a decision that AI should be making? Is the right data being used? Are we checking the data for bias? Do the humans involved understand the AI and how errors could be made? Were the end users trained appropriately? And do we understand the true impact of these AI systems? So, let's go through and compare. For NARCS, the basis of it, it uses data for doctor shopping as a proxy to figure out overdose risk. While for TRUES, it analyzes real-time physiological signals for early detection. Let's look at the data. The data from the prescription drug monitoring program, originally used for punitive outcomes, but is used to make medical decisions. While for TRUES, it uses historical medical data to make medical decisions. For NARCS, you can Google it and find lots of videos, but what really stands out about TRUES is the way they did their implementation. They did personalized deployment at every single hospital, integrated it into the workflow, explained the algorithms to the clinicians that were using it, and even when training was done, there was a super user. So if anyone had questions or wanted to talk to, they still had that. Transparency. They're both behind proprietary algorithms, so there's a limit to how much we can see into it. But for TRUES, there are multiple research articles that are out and public about the efficacy and how well it works, as well as the limitations. And then lastly, the human role. So with NARCS, humans are the gatekeeper, but with TRUES, clinicians can be the champions for the patients. So I do want to take a second to say, we're in such a pivotal time in history, and working in tech, being in tech, is political and it matters. We don't exist in a vacuum. So while we celebrate in our successes, we also bear the brunt of our failures. So whether you're a data analyst, a developer, people ops, people leader, we all bear the burden of making the right choices. And whether it's AI implementation in healthcare or the AI that is used with ICE agents to terrorize, surveil, and track innocent people around the country, those are all choices. And it is very, very, very important that we ask, what about humanity? Someone has to approve those PRs. Someone has to run those tests. Someone has to make those deals. And the next time an AI system is implemented, the next time you think about implementing an AI system, ask yourself, would you want to be on the wrong side of that algorithm? Okay, thank you.